What's up? This is Dr. Charlie Johnson, physical therapist, board specialized in orthopedics, and I help people all around the world with back, butt, and sciatica problems learn to fix themselves naturally using the power of their mind and movement as medicine. And in today's in-depth training, really excited to bring this to you. I'm going to help you do what I call decode your medical diagnosis with movement. And so we're going to translate your medical diagnosis into something that actually makes stinking sense. What a novel concept. I know, but if you're watching this, you have some type of back, butt, or sciatic issue, and you're frustrated by all the runaround. Maybe you're going to see the hip doctor, and they say it's a hip problem. The back doctor says it's a back problem. Nobody can really agree, and you're just kind of lost and confused in all the information out there as it relates to these problems, and you want something that makes sense, then stick around. My promise to you in this video is that I'm going to teach you how you can translate your medical diagnosis into something you can see, feel, and understand, a movement diagnosis. I'm going to show you a simple 6-part movement exam that helps you clearly define your movement diagnosis. We're actually going to walk through that here live in a little bit. And I'm going to help you understand how your movement diagnosis highlights exactly what to fix, what to track, what to tweak, and how to treat your specific issue. Okay, so understand that this is actually the first step to healing. There is a framework that we use, a 4-step pain relief process that I've developed to help people with back, butt, and sciatica issues heal naturally. This isn't all of it. A complete video would take many, many hours, but this is a good chunk of it. It'll really get you headed in the right direction. Again, if you're confused about sort of your diagnosis, what's going on, and where you should take the first steps. All right. So let's dive into it. First thing you need to understand, let's meet you where you're at. Your medical diagnosis is most commonly based upon the results of a static image, right? So if you have back pain, you go to the general practitioner, your primary care doctor, and they say, hey, let's get an x-ray, let's get an MRI, right? Those types of things. And this is how we sort of label you with a specific diagnosis. And it usually looks something like this, which doesn't look like a whole lot to you probably, right? And so you take this and you send it to people and you try to get opinions. And again, it's a little bit foreign to you. And most people, what's interesting about this is, yeah, you take a static image of your back, you're laying there in a tube or, standing there or doing whatever. But most people describe pain that occurs with life, right? And life is motion. So if you have pain when you're moving, then does it make sense to take a steak sounds good, by the way, to take a picture of your back when you're just sitting or lying still, right? Probably not. And not to mention, most people are unable to make sense of their images, findings, and reports. I don't know about you, but that stuff's even a bit confusing to me still. And so chances are it doesn't make a whole lot of sense to you either. And so again, this is probably something you're not familiar with, and it sends you down a rabbit hole trying to figure out what all this even means. Does this look good? Does this look bad? What's going on here? And we did a little study in 2019 that looked at sort of the ability for people like you to understand what's going on with these reports that you're given, right? You get an x-ray, you get an MRI, you want to get the report, and what do? You read through the report, you post it online, you call your friends, you call your aunt who used to be a nurse or whatever, right? And you try to get information about what it all means for you. And it causes people to become frustrated and concerned and worried and all this good stuff, right? And so what we found is we wanted to see, again, how readable these reports were that you are receiving. And what we found is that it's written at a 12th grade reading level. And at least here in the US, I think we're at like a 5th grade reading level, which means like nobody can freaking understand these things, all right? Not helpful. And oh, by the way, it only looks at the physical body, not the mind. How do you take a picture of the mind, right? So it takes a snapshot of your physical body, your bones, your muscles, your discs, things like that. And if you have watched any of my other content, you realize that pain is an experience, not just of your body, but then also of the mind, first and foremost, actually, right? And so when you move, it hurts. And the more you move and the more it hurts, you become less confident, you become more worried, more concerned, more anxious, more fearful of certain movements. And then guess what? Brain shuts down your body, mind shuts down your body and says, hey, don't do that, right? And then you become more fearful and worried and so on and so forth. It's a negative feedback loop. And so we need to treat pain as such. And so what this all means at the end of the day, pretty crazy if you think about it, but if you boil it down, it means you're spending your time, energy, and money on a picture, literally a picture. I mean, thousands of dollars for a picture. I'm looking for a picture, all right? That probably doesn't actually capture when you have pain, because unless you're telling me, hey, Charlie, I have pain when I lay like a hot dog in a tube, that's when the image is taken, an MRI in this case, then probably doesn't make sense to take a still picture if your symptoms occur when you move or when you bend or when you lift or when you're at work, right? It probably doesn't accurately capture why you have pain because we know there's little to no correlation between the images and what they see on them, the findings, if you will, and the pain that people experience. Lots of people have arthritis and degeneration and these sort of ugly things going on, but they're actually sort of like wrinkles on the skin. They're sort of normal. You're not going to get through life without them, without these findings. It's probably something that you can understand. I think we all can agree upon that. Probably didn't flash up that image and you say, yep, makes total sense. I got it. And only accounts for part of the pain experience. It only takes a picture of the physical body and ignores the mind. So is it really worth it? Doesn't sound like it to me, right? But just consider that understanding your medical diagnosis is like trying to understand this, hieroglyphics. Are these hieroglyphics? I don't even know, all right? But I see like a hawk and a turkey or a turkey vulture and a flag. I don't really know what's going on here. Now, maybe you do, but again, that's like your image, all right? It's like a foreign language. How are you going to understand something that's not written in your native tongue, if you will, right? The doctors might understand it, but to you, again, it's foreign. It's outside of you. It's something you're having to research, something you're having to try to learn on your own. And trying to use these hieroglyphics, right, this image, if you will, to navigate your path to healing is like trying to walk through a corn maze in the dark blindfolded. Pretty impossible. You're going to get lost, all right? Or something's going to eat you, all right? This is a really dark picture, but that says corn maze, all right? I'm in the center, my daughter, Cameron, my wife, Heather. So it's no wonder, right, if you're walking around this corn maze, lost and confused, if you're scouring the internet, confused about what's going on because you just don't understand any of these images or findings and you're just randomly typing things in, trying to figure out what you need to do, it's no wonder you're lost, frustrated, confused, and feeling dependent upon someone else. Imagine I'm walking through that cornfield like this. I mean, I better hope I have somebody behind me helping me navigate. And that person behind you is maybe your orthopedic doc or your chiropractor or your neurologist. But they're using, again, a lot of times the findings of these images to help guide you, which makes you dependent upon them and frustrated because it's not something you can really grasp. All right, so let's help you grasp it. How can we take that stuff, right, the hieroglyphics, the image that you don't understand, and translate it into something that is native and unique to you that gives you real-time feedback? How can we do that? Well, first things first, since everyone has image findings of herniated disc, DJD, DDD, LSS. I did that for a reason, right? Because you don't understand what those things are. Degenerative Joint Disease, Degenerative Disc Disease, Lumbar Spinal Stenosis, an HNP, a Herniated Nucleus Pulposus, and other problems. But you are the one in pain. Why not evaluate it using something that you can see, feel, experience, and totally understand? I know, it makes sense, right? And you can translate this thing on this still image into something that makes sense. How you feel when you move your body. We can use movement to help you better understand what's going on. And this is where I introduced something called the total body scan. Remember a little bit earlier, I promised you that I would actually walk you through a process, 6 simple motions to help you kind of decode your medical diagnosis into something, again, that totally makes sense to you. All right, so let's walk through it right now. All right, so these are the 6 motions I bring everybody through who works with me privately to help get a baseline of what things make you feel good and what things make you feel bad. Today, we're going to focus on just the yucky motions, meaning I'm going to have you go through each of these motions, kind of go through them with you. Feel free to go back and watch this a couple times as we're going to kind of just cruise through it, but you'll get the gist. All right, so we're going to go through these motions. There's 6 motions, but realize there's right and left side of the body. So that's kind of 12 motions, and then there's some in between. So like 12 to 14 motions here. The purpose of this total body scan, again, just know this, is not to flare you up. It's simply to help you and or us explore how your body responds to motion. You don't have to push through pain. Just kind of note what things feel yucky. Record your yucky motions. I don't care if you want to put them on a napkin. I don't care if you want to put them in the back of your brain. It doesn't matter. Important distinction. As a rule of thumb, yucky motions are motions that reproduce your specific pain or problem. All right, so you're probably watching this video with some type of back butt or sciatica problem. Maybe it's in your right butt cheek, your left butt cheek. Whenever you do these motions, I want to know, hey, what are the motions that reproduce that specific problem that brought you to me, all right, that brought you to this content? So let's go ahead, 1 rep each, 1 at a time. We don't need to do hundreds of these things, flare you up 1 or 2 times and just get an idea of yucky or not. So let's do this together. All right. You're going to start by taking a seat, twisting your trunk to the right, I don't care what your feet do. I don't care where your hands go. I just want you to twist your trunk to the right. Is it yucky or not? Write it down. Now, twist your body to the left. Same thing, just to the left. Is it yucky or not? Next, pull your right knee to chest. Ugh. Yucky or not? Other side, left knee to chest. Right ankle up on the left knee. We call this a seated figure 4 on the right in this case. Almost like, call this a toenail test. You're going to try to cut your toenails or clean the bottom of your feet or something like that. Or put on your shoes or socks. Is it yucky? And now do it on the left. Is that yucky? Again, you can go back and check these out. Next, let's do a leg raise. So what you're going to do is you're going to start with your heel on the ground. You can lean back and hold on the chair if you want, but you're just going to raise it up as far as you comfortably can. Yucky or not? Left leg raise. Yucky or not? Next, seated forward bend. Yucky or not? Does it reproduce your specific pain in the back, in the butt, in the leg, in the calf, wherever it may be? Now we're going to go to the right. So put your hands on your right knee and forward. Push yourself back on up. Other side. To the left. To the left now, y'all. All right. To the left. Is it yucky or not? So we're in center, right, left. Now we're going to stand up. We're in a standing position. Make sure you don't fall over. Any hands? I just put them like this on my back, but you can do them like this if you want. All right. And you're just going to bend straight back. Yucky or not? Now we're going to test back to the right. So you're going to stand, you're going to twist your trunk, and you're going to bend straight back. Right. So notice I'm still going straight back, but I'm twisted before I bend straight back. Kind of closes down on some of the stuff in the backside, the joints, the discs, things like that. You're going to left. Remember, is it yucky or not? And that's it. You're done. You didn't need to wait weeks to lay in a tube, to wait for an opening at the MRI machine. You didn't need to wait weeks to see the specialist. That was the evaluation. All right. So did you identify any clear, consistent, yucky motions? Pull up your little napkin, go to the back of your brain, your iPad, whatever. Were there any clear and consistent yucky motions? It's okay if there were many. Heck, it's even okay if there weren't any. By the way, if there were not any yucky motions. You're like, Charlie, see, your motion exam, your body scan, it doesn't work. Nothing's consistent, nothing's clear, nothing makes it worse. Be sure to check out my Better Than an MRI DIY diagnostic guide. Scroll actually all the way to the bottom. You might be missing something. There's a video I want you to watch called The Missing Link. Basically, if you go through a bunch of emotions and there's nothing clear, there's nothing consistent, things seem weird and aren't making sense, check it out. Okay, so understand that if you did find some clear, yucky motion, hey, when I do that leg raise, when I bent back, shot me right in the butt. All right. A problem that is reproducible with motion is almost always reducible with motion. A problem that is reproducible with motion can make it worse, yucky motion, is almost always reducible with motion, meaning you can almost always make it better with movement. So if you identified some clear yucky motions, then this begins to define your movement diagnosis. This becomes your movement diagnosis. So let's be clear about this. Here's your diagnosis. When I do this motion thing, it hurts. Now, look, I know you might think that's too simple. I'm clicking off this video. The dude's crazy. But either you make this simple or you go back to the hieroglyphics. You go back to trying to understand your x-rays, MRIs, and relying on someone else. It doesn't have to be hard. All right. So instead of, look, I have a grade 1. Have you ever received a report with something like this? Herniated disc, anterolisthesis. I have a grade 1 anterolisthesis with moderate lateral recess spinal stenosis. I know you've read your MRI report, your x-ray report if you've gotten it, right? And it probably says a bunch of junk like this that you just don't get. This is your medical diagnosis. By the way, written by a radiologist who doesn't know anything about your case. All right, they never evaluated you, nothing. They're just writing this and they're just telling you, this is what the picture says. Just like that picture of me at the corn maze. Oh, there's a younger gentleman standing there in the middle, and there's his wife, and she's wearing this color scarf, and there's his daughter, and it's hard to read. It must be dark out, and That's all they're doing. They're just describing the picture. So instead of having this, which clearly makes no sense to you and is even hard to say, hieroglyphics, your image, you have a yucky leg raise. That's it. That's your movement diagnosis. How much easier is that than trying to understand all of this. Much easier. So your movement diagnosis is the coolest thing. Tells us 4 things. And there's no waiting time. You don't need to wait to see a specialist. You don't need to shove yourself in a little tube. You don't need to stay still for 30 minutes and feel claustrophobic. You don't need to take off your favorite jewelry because you're worried about the magnets. Nothing. You just did it right now. Your movement diagnosis tells us 4 things. Number 1, what to fix. Number 2, what to track, so we know if we're getting better or not. Number 3, what to tweak. And number 4, how to, at least a starting point for, how to begin treating this issue. So again, you can try to fix this. Go ahead. Can you, with what you know right now, can you fix this? Charlie, I don't even know what I'm looking at. All right. Or could you fix this? Which seems more feasible to you? I would argue most people will probably agree that, hey, I kind of get that thing. I can do that thing. I can be anywhere and do that little leg raise. Great. And it makes sense to me. I can see it. I can feel it. I can understand it. And I can track it. Imagine having to go back and get an MRI every single week or every few weeks and having to pay for all that and having to drive to the hospital or to the outpatient center or whatever, lay in that tube again, right? All that stuff to try to see, is my disc getting better? Imagine doing that. What a waste of time. Instead, what if you could just track how you're moving? Oh, my movement quality is getting better over time. It's staying the same or it's getting worse. Looks like I have to keep doing what I'm doing. I got to change things or I should do something else. Novel concept, but hopefully it makes sense. And why do we care about this? Well, Charlie, I don't care about my leg raise, man. Why should I care about my leg raise? Well, here's why. You'll care about your leg raise when you realize the reason you can't kayak or sit like this with your legs straight out is because you can't do a leg raise. So when you free up that leg raise, you'll be able to do those things. Trying to bend over and, I don't know, put a bunch of stuff inside a wheelbarrow kids or sticks or leaves or whatever, right? That is a leg raise. And so these motions show up in your life. And so this is why we care about improving these individual motions. I could care less about the leg raise in and of itself, but I care about it because it's keeping you from doing the things that you want to do. And that's why I think you should care about it too. It tells us what to tweak. What do I mean by tweak? Temporarily modify, change, stop, things like that. Or if you have a yucky leg raise, that thing in the center, well, then guess what? If you sit at night like this, that's going to be a problem. You're just putting yourself in that yucky motion unintentionally. And this is the tricky thing. Usually habits, things people don't know they don't know. Habits, routines. Picking something up like this, that's a leg raise. If you sleep, sort of subconscious, if you will, and you lay like this, that is a yucky leg raise. Charlie, I don't know why I can't run. Because you've got a yucky leg raise. We go to the top here. Why can't I drive? Because that's a leg raise. That doesn't mean you have to stop all these things 100%, but you need to first be aware of them. If you're not aware of them, then guess what? You're not going to get better. And you're going to be doing all these different stretches and all these different exercises like the ones you see here, and it's not going to be helping. And oh, by the way, you might have to stop the things you've been told to do. Most people aren't experts in this area. And so, oh, you have a yucky leg raise, you have sciatica? Do yoga, do the down dog. Well, guess what? Do the thing, which is a yucky motion, over and over again. Really bad idea. Do nerve glides. You have a yucky leg raise? Let's have you do the same exact yucky motion over and over again. We're going to call it nerve glides, but it's really just a yucky leg raise in disguise. Oh, and this, your hamstrings are so tight, and that's why you have sciatica. Yes, and that's also my yucky motion. And so are you telling me that if I just keep putting myself into a yucky motion over and over again, that I will eventually get better? Bad idea. Bad news bears. Doesn't make sense. Again, this is life. Right? It tells you how to treat it. If you have a yucky leg raise, we can treat multiple different ways. I like to start in kind of 3 different ways, all right? So you can say, okay, I got a right yucky leg raise, but what about if I do things on the left? Does my left yucky, or does my left leg raise, which probably isn't yucky, but might be, let's just say it isn't yucky on the other side. What if I treat the good side to try to fix the bad side? Huh, that's different. What about if I move my body in the opposite direction? So everybody's trying to tell me to go forward, maybe do these nerve glides and these hamstring stretches, but that's kind of yucky. What is the opposite of yucky? Yummy. What is the opposite of forward? Backward. So when I move my leg forward, it's yucky. But if I move my leg backwards, will it be yummy? Very good question. And so we can test that. This would be one example of a motion that sort of brings your leg, that same leg, in the opposite direction. What about taking the opposite approach, Charlie? Everybody's telling me to try to lengthen this thing, pull on this thing. But what if I could bring it closer together and I could give it some slack? Huh. Wonder if that'll do anything. Right. And so look, there's 118 different movement options to try to resolve back and butt sciatica problems. That's based off my experience and sort of the process I developed. So these are 3 options. All right. But this is the idea. Right. So opposite side, if one side doesn't work, can you treat the other side? Opposite direction. If righty equals tighty, does lefty equal loosey? And then opposite approach. If you try lengthening something doesn't work, what if you bring it closer together? That's what I call like the law of opposites. So let's just rehash this so you get the utility of this. All right. Big picture. So you started off with something that you thought was going to help you. You went to the doctor, get an X-ray, MRI, right? You thought that's what you needed. I get it. That's what everybody thinks. But you don't actually need those things in 99% of cases, all right? You can't understand it. I mean, you can feel it, I guess, as like a film, right? But it doesn't do you much good. You can see it, which freaks you out. You can't really understand it, and I think you agree. And so you're left in a little bit of a pickle, because what do you do with that thing? You try to treat that thing? Well, again, it's like a map that you don't even understand. It's like trying to read a book that is in a different language. So the first thing we do is we translate that thing, which makes no sense to you, into something that is native to you, something you can see, feel, understand, experience. You've got a yucky leg raise. Wow, that's so much easier, Charlie, than looking at that MRI film or that X-ray or trying to read that report and Google it. I have a yucky leg raise. That's my new diagnosis. Wow, that's so much easier. Great. So now we know what to fix. We got to fix the yucky leg raise. Now we know what to track, we know what to tweak, and we know what to treat. Fix, track, tweak, treat. Say that 5 times fast. So again, imagine that every week to see if you were getting better, you had to get another MRI. Imagine the waste in time and energy and money. So we don't do that. We can track this. It's readily available. You can do it wherever you want. We can determine if what we're doing is working, not working, or making us worse. And again, why does this matter? Because this motion, this isolated motion, which you or I don't really care about, shows up in life in things that we do care about. It tells us what to tweak. It tells us what we need to change or modify or maybe avoid. It tells us, hey, those things that I was told to do, which I've been led to believe will help me, those nerve glides, those hamstring stretches, that yoga, actually, now this is my yucky motion. Totally makes sense why I'm not getting better. Tells you what to stop. And it gives us some idea. Again, not the full picture. There's more of a process here, but gives us an idea about where we can start. Law of opposites, rule of opposites. We've got a yucky motion. We can look at the opposite side, opposite direction, opposite approach. Translate from something you don't understand into something you do understand using motion. Everybody I work with goes through the same exact movement exam, if you will. Now you could argue, well, Charlie, I went through those motions and none of them make me worse. Again, you can check out my DIY diagnostic guide. I explain why that happens. Or maybe these motions just don't capture what you're dealing with. If hopping on one leg is what makes you worse, then that is something you could fix and track and tweak and treat. Trying to take medical diagnosis and translate into something that is unique to you, movement diagnosis. Right? And again, the coolest thing is that once you learn this, you learn this once, this process. Yeah, I see the way Charlie thinks. Now my shoulder's starting to hurt. Okay, well, I could get an X-ray. I could get an MRI. They're going to show a rotator cuff tear. They're going to show this. They're going to show that. But at the end of the day, I've just got this yucky chicken wing motion. All right. So now I know what I need to fix, what I need to track and tweak and treat, right? So when you learn this once, you can apply it to anything else. And you rely on nobody, all right, now or in the future. But there's a process, okay? So hopefully this was helpful. Hopefully this kind of gets your wheels turning, right? Your juices flowing, if you will, such that you can see that, wow, I don't need to rely necessarily on the X-ray MRI. I am not my X-ray or MRI. And all that stuff that's found on X-ray or MRI may not actually be causing my pain. It doesn't actually capture when I have pain, which is when I'm moving or doing things, and I'm just kind of laying in a tube. And lots of people feel those things, and maybe it's not the cause of what I'm dealing with. All right. And so how can you go from a place of feeling frustrated, confused, disempowered, and maybe even fearful of those images and take back control? And you can do that by using movement. Not only movement to evaluate, then using movement as medicine in this case. Okay, now we outline a 4-step pain relief process that we walk everybody through. Again, this is our exclusive specialty. I'm a PT, I have my orthopedic board specialty. I only help people with back, butt, sciatica problems, just like really focus on helping people like you solve these problems. We first optimize things. You cannot exercise the bad diet, all right? Mentally or physically, you've got to clean up the environment. That's where we talk about tweaking things and teaching you, again, some of the stuff we talked about today. You've got to have something you can track. Otherwise, you can't manage what you don't measure. You've got to be able to use movement and, yes, mind. We didn't talk much about that today, but you've got to be able to treat the pain experience, brain and body, right? And you've got to be able to systematically use them as medicine, not just do a bunch of random things. Most people will find just one motion that works best for them. And then there's got to be a process for, okay, my symptoms have gone away, but I'm still fearful. I still want to get back to full speed. I still need to build up my strength and endurance and this and that, right? How do I get back to normal? How do I get back to life, all right? So that is the process we teach people. And if you're interested in learning a little bit more about that process and sort of how we think and troubleshoot these problems, go ahead and I would invite you to register for my free workshop. I call it the Beat Butt Pain Workshop. You can literally just click probably below in the description and or in the comments to check out this workshop. I'd love to have you there. All right. So again, that's it. That's all I've got today. Hopefully this was helpful. Let me know your thoughts below in the comments and we'll go from there. Thanks so much. Chat soon.